Good morning. I think had expected to do this maybe inside the atrium, but there's a lot of hustle and bustle in there this morning. You'll note coming in that there are fire authority members getting vaccinated today, others, quite a bit going on. I want to take a minute to give thanks to the public for their patience. I'd also like to let people know that as we roll out our vaccination effort here at Salt Lake County, we continue to work on the general health of the community. And we know that cases are going up right now. We had a big day yesterday, unfortunately. And it's more important than ever that people remember to wear their face coverings and limit their activities. Social distancing, less is more right now. While we see hope on the horizon, and many are indeed receiving the support they need right now, this will take some time, and we don't expect a decline for a few months at least. So with that, it's got to be a conservative couple of months right now. I want to compliment the health department. They have pivoted at every turn. We have built capacity where it's been needed. And I'll tell you, there's nothing harder than working hard, changing the way you do things, and then being asked to take on an additional assignment as this. They've done it willingly and with grace and with professionalism. And I'm really happy to report today that Salt Lake County has this under control. You all, public, will be receiving a vaccine. What we can't give you today is a date. And we ask for your patience. We're organizationally prepared. Right now our organization is focused on subgroups. You can imagine, as we have supported clinics throughout the county, that we have a really defined list of people to reach out to. That's true also of the emergency responders you see here today, from fire authorities and departments and others. But when we work through those systems, we're working with scheduling, and we're also managing those systems as it relates to the supply. Our supply is limited. We can pivot on a moment's notice to give more vaccines, but our supply is limited. Before I introduce the key folks behind this amazing effort, I'm going to share that our community, our county, will get COVID-19 behind us due to partnerships with the state, with the CDC, the federal government, the same people we've been working with throughout COVID-19. I'm excited to see leadership change and more of a focus by the incoming president on this challenge. That's very good news. He's pushing broader systems, which will help us in the end. That's very good news. But we do rely not just on our government partners, but many other partners, including the hospitals, nursing organizations, and others. And we will be relying quite a bit on our nonprofit partners, because a focus on the communities in need is very much a part of our vaccination effort. So I'm going to invite in a second Gary Edwards to speak. Gary has had many 16-hour days, and I want to thank him and his family for their commitment. I'm also going to introduce today Dr. Audrey Stevenson, who's here, and also Jill Miller. These are the two that are running this effort. Audrey has many certificates and degrees, and including a PhD, to do this work. She's recognized nationally and is very much part of our national conversation about immunizations, immunization policies and plans. This is the big one for her, but she's been at this for a long time. Jill Miller is a very skilled person. She also has a public health degree, but she spent years in her career at the Sundance Institute running their operations. And if there's anything that will mimic the complexity of a film festival and operations of a big organization, it's this initiative. Right now we're using clinics in smaller spaces. Of course, we will be staffing up and moving our operations to very large facilities. So with that, I guess I'll close by saying I had the honor to work at the Olympic Games. I also had a chance to work at the University of Utah Health System at the Moran Eye Center, where I was involved with hospital operations to a certain degree. And those positions have served me well. I'll tell you, this is like running an Olympic Games right now, but not knowing how many athletes on the field and in advance, and knowing where and how they're going to compete. So with that, we have prepared to pivot, we have prepared to expand our capacity, and we're really enjoying right now the plans for the large scale vaccination operations that will be rolling out sometime in March, we believe, based on supply. So with that, I'm going to turn it over to Gary.
Good morning, everyone. Thank you for being here. Thank you, Mayor Wilson, for your continued support, encouragement, and dedication to this effort in Salt Lake County. We've been at this for a long time, and as Mayor Wilson indicated, we're seeing now, unfortunately, what we thought was going to happen as a result of gatherings during the holidays. Certainly, individuals wanted to gather with family and friends. We knew that that would end up resulting in increased cases. You, along with us, saw that happen yesterday, and we anticipate that will continue for the next number of days. What we're seeing now is the Christmas week, and next week we'll begin to see the New Year's week. At the Health Department, we are continuing with our efforts with contact investigation, case investigation, contact tracing, testing, quarantine and isolation, reaching out to vulnerable populations to assure that they have the necessary resources they have to be able to successfully isolate and quarantine when needed. In addition to that, obviously we are involved actively in the vaccination rollout. As Mayor Wilson indicated, the supply is not great. We are getting doses in arms quickly. The doses that we have available to us are either in arms or are committed through next week. We continue to work with the priority groups. Those priority groups remain healthcare. You know that hospitals received a number of doses. We received doses for non-hospital health care, and then EMS and first responders. And so those are the groups we've been working actively with. We anticipate that additional priority groups will be announced by the state, and we will be prepared with the doses we have to begin vaccinating those individuals. As Mayor Wilson indicated, we plan to have doses for anyone who wants a dose, but that's going to take time. And we again ask for individuals to understand that, to be patient, to utilize our online registration or our phone registration to be able to access those doses as their group becomes announced as being available. With that, Mayor, I'll turn it back over to you.
All right, just questions for Gary, myself, Audrey, or Jill.
With the President-elect's announcement that the second doses will be pushed forward more quickly, could you talk about the county's plan on that? Is there any concern that if there's a production problem or something, there might be a delay in receiving the second dose?
I couldn't hear the second part of what you said.
How does the county make sure people get their second dose on time? Do you hold back any doses? Sure.
Each dose of vaccine that is allocated for an individual, be it Moderna or Pfizer, has a matching booster dose that is kept aside by the vaccine manufacturer. The system of delivery is that for Pfizer, the booster dose will become available 21 days later for those individuals vaccinated and 28 days later for the Moderna. any person that gets an initial dose is guaranteed their matching booster dose. We have a system in place for being able to do reminder and recall for those individuals who are receiving the vaccines from us, that will notify them when they need to make their appointment for their follow-up dose. But those allocated doses are not kept aside by us. They are being kept by the manufacturer and are delivered solely for the purpose of that booster dose.
So I'm optimistic that both the drug manufacturers, the CDC, and we in this county are prepared. It's a big country. You know, we have vaccines going from our suppliers to other nations, right? So I'm optimistic that we're returning health, and I think there will be a critical point where hopefully we can have our cases flatten and then see an actual decline because the ability to spread becomes less in the community. I think patience is the important word, because we don't have a crystal ball here at Salt Lake County to know exactly when things are rolling, but I think we are somewhat optimistic, and I'll let Audrey take this because she's the one most in touch, but I think we are seeing additional vaccines coming, and our assumption right now is we will see quite a bit of doses moving in future months, probably not future weeks, but I'll let Audrey correct anything I just said or add to it.
What the mayor just mentioned is absolutely correct, that as we see other vaccine products that are also being added as they complete their final studies, their phase 3 studies, and they actually get the emergency use authorization, we're going to see additional doses coming into the country on that. And so, as the mayor mentioned, we are allocated doses based upon the number in our population, and so other states that have higher populations are receiving higher doses of these initial products that are coming out. But in upcoming weeks, we're going to see manufacturing able to produce additional doses that will be going countrywide, so we'll be seeing increased numbers. So right now, the state is receiving weekly allocations from the federal government. Right now, we have both Pfizer doses that are coming into the state, as well as Moderna states. Going forward, it's contingent upon the doses that are available. We don't have exact numbers of how much we're going to get in weeks to come. We have just estimates that the state health department is monitoring. They are the ones that work directly with CDC and with the manufacturers to determine how many doses we're eligible to receive on a weekly basis.
We have a question in the chat. To be clear, will the county be the entity that distributes vaccines to the public once they're widely available, or will other entities offer the vaccines as well?
Do you want to answer that? So, as the mayor mentioned, we are utilizing partnerships both with the federal government, our state partners, as well as our community partners. Moving forward, when there are sufficient amounts of vaccine to be able to redistribute, there are a number of different vaccinators that are very interested in being part of this effort. This includes retail pharmacies, this includes other private physicians' offices, community nursing service, and other vaccinators that we have both within Salt Lake County and within the state. So once there are sufficient doses to be able to redistribute, then yes, there will be multiple access points for an individual to be able to receive a vaccine. Right now, there aren't sufficient numbers to be able to redistribute to all of those other vaccinators that are interested in participating.
And then Audrey, could you clarify teachers and how they'll roll out?
So in Salt Lake County, teachers, both those in the 5 school districts as well as private schools, charter schools, K through 12, will be receiving their doses of vaccine from Community Nursing Service, who is one of our excellent vaccination partners. They will be making appointments with those school districts and with those schools to be able to deliver those vaccines. Unfortunately, the vaccine supplies are limited, and so it may take us several weeks for all of those teachers to be able to receive that vaccine.
Do you have a way of prioritizing that subgroup of teachers who would get in as early as next week and then the week following? If you have such a limited amount, maybe some teachers could get it next week?
The school districts are making those determinations. Yes, Community Nursing Service has been working with these districts and these school systems now for the past week to set up those appointments.
Can you just talk a little bit about your board? And I see what's on deck, but
Do you want to do that?
Who wants to walk?
Okay. So what you can see by the board is that we already have in progress, since December, the hospital systems have received vaccine. Many of them have already completed the second dose for their allocations. They have been doing that independent of the health department. Since that time, those non-hospital healthcare workers have been being vaccinated since December 28th from our health department. So you can see that those hospital systems and our hospital personnel, those non-hospital healthcare workers are still being vaccinated currently. As you can see around you right now, we're doing first responders this week. We should be complete with most of the first responders by the end of the week. Going into our next priority group, we've already been vaccinating those EMS that are identified as non-hospital personnel because of their emergency contact with patients. So you can see that that's underway. K-12 is the next group that in the prioritization. And again, just as a point of clarification, the priority groups are defined by the state. And the state and the governor's office, along with their task force, determine who is next in line in those priority groups. That is a determination that is made at a state level. Long-term care? Long-term care facilities also were one of those initial groups that received vaccine, and they were vaccinated under a little different plan. Long-term care facilities were vaccinated by doses that were given directly to national pharmacy chains. Those national pharmacy chains in Utah included Walgreens, CVS Pharmacy, and then Community Nursing Service was another vaccine entity that went into these long-term care facilities. Just the same challenges we've had, they have had to roll this out over a number of weeks in order to be able to accomplish the vaccination of all of those long-term care facility residents and staff. And so many of these long-term care facilities are still in process, but in many cases, many of them have already been completed.
Are you all concerned about the gap that the state health company is reporting between the number of doses that have been shipped and the number that have been administered? And right now there's only like 42% of what has been shipped directly from the
Do you want me to address that?
Yeah, sorry.
Okay, so he was asking about the gap between the number of doses reported. There's something to consider, and that is that the numbers reported are those doses that are in process of being shipped in many cases. And so when you try to look at the number of doses that have been allocated for the state and you look at the number of doses that have been delivered, it's not in real time. And so there's a gap that is established. But I can say that those doses that we are receiving at the Salt Lake County Health Department and for our vaccine activities have been administered just as quickly or allocated just as quickly as we can, and in most times we are using the doses that we have received within that same week of receipt.
Do you have a sense of the acceptance rates among healthcare workers? How many healthcare workers are choosing to get the vaccine?
What we're hearing in the public is 60%. I heard a report this morning that was reporting 60%, and that's what I'm also hearing in the community, is about 60% acceptance rate. However, some of the hospitals are stating that although individuals didn't receive it when it was first offered, that up to 80% at some point will be accepting this vaccine. And there's a number of reasons why somebody may have delayed getting it with that first 60%.
Timeline for the 75 plus group?
That's yours.
They obviously are the next group in line. And as Audrey indicated, the state sets those priority groups. So when they indicate that that group is up, then we will be prepared with doses that we have available to start rolling out with that population.
When you talk about all the different groups for vaccinating the general public, you know, part of the plan being mass vaccination sites, much like the county does with the flu vaccine.
I think there's a great level of interest for that. You can see that we have a mass event that Jill and her staff have put together here at the Government Center. Jill and her staff have put together several very successful events at the Maverick Center and at other large venues to be able to vaccinate large numbers of individuals very quickly. When we look to our other partners, you know, the long-term care facilities are being done on site, but I think a lot of the vaccinators, such as the hospital groups and others, have been looking at some of these similar models.
Good. All right. Thank you, everyone.